Now, I'm going to do a few tests here just to see how bad it is from my perspective, okay? So I'm going to do a few of the tests that I would do for cranial nerve exams, okay? For the touching aspect, okay? So I'm going to be slightly moving your head back and forth, up and down, just seeing where your range of motion is, okay? And then from there, we will move on to the touch portion just to make sure that your nerves in your neck and your shoulders, as well as your lower head region, that you have the feeling in each spot, okay? So we're just going to test those out just to make sure that that's not the issue, because then we'll have to do a whole another range of tests if that is the case, okay? So we are going to move and start with just slight motions. Do you mind if I... Okay, perfect. And what I'm going to do is just slightly move you here, okay? And your neck seems to have very little mobility there. Okay, and then just on this side as well, we're going to do the same thing. Not much range of motion at all, I see, okay? Now we're just going to try and lift your head back a little. That's as far as you can go. Okay, and now we're just going to try and do the same and just go forward. Oh, it's even worse for that one, that pain level. That's a lot for you? Okay. So I think we will try this really quick because I already think I have an idea of how we can relieve this, but I'm just going to check out your nerve system in your touch sensories, okay? So I'm just going to poke you in just certain places, okay? Just on your forehead, on your cheeks, on your chin, on your neck, and just on the top of your shoulders here, okay? And I want you to tell me if you can feel me tapping that with this, okay? Okay, are you ready? We're going to start with, you can feel that on your forehead, okay, good. Good, and you can feel this. Good, and you can feel this on this other side. Okay, good, good. That's very good. So then what about just on the lower chin part here? You do feel that? Okay. Not as strong as up on the face. Okay, let's move down to just under the neckline there, okay?